First and foremost, just want to send a big thank you out to each and every one of you. I can only imagine the mental and physical stresses and just fortitude that you all had to show over the last 2 years to really help maintain patient safety and make such a drastic impact on care across the continuum of care during the tragedy that was the pandemic. As far as today goes, I'll go ahead and jump into the material that we'll be covering. So my name is Scott Rapplean, and I'm the Director of Healthcare for Symmetry Hand Hygiene. And what we'll be taking a look at today is the Symmetry program. And we're going to look at how we can leverage formulation, innovation, and behavior modification to ultimately improve hand hygiene compliance and improve patient outcomes. So what we're going to review today are the aspects of the program that have shown so much value and had so much clinical impact on our partners across the globe that they have since elected to implement the program because of how we're able to significantly increase that patient outcomes and compliance with a multifaceted approach to addressing hand hygiene at all levels. So what we'll review will be a very in-depth analysis of how we go out and not only state and showcase what we're able to achieve, but actually show it through on-site clinical evaluation, as we've done with a multitude of our partners across the U.S., whether you're looking at an Advocate Aurora Healthcare, a BJC Healthcare, or an Emory University Healthcare, for example. So as we set out to build this line well over a decade ago, we were very focused on achieving the best practices based on the data that was outlined from the governing organizations that we look to, such as the Association of Infection Prevention Nurses, APIC, the CDC, the Joint Commission, and of course the WHO. And when we started with the chemistry development with our lab team, we were very specific that we didn't want to just create another soap or another sanitizer. We wanted to build in attributes into these products that would make them so uniquely gentle that clinicians would want and prefer to use them. This ultimately led to our guiding philosophy, which is acceptance leads to compliance, which of course leads to a lower acquiring of hospital infections. Because if you think about it, on average, your nurse during that 12-hour shift, they should be performing hand hygiene in excess of some 200 times. So if midway through that shift, my hands are experiencing dermatitis, they're dried out, they're irritated and chapped, it's only natural that folks begin to skip out on those key moments to perform hand hygiene simply to avoid that discomfort. So we bang our heads against the wall constantly to try to come up with all these different ways that we can get the clinical team to simply use the products at the key times that they should, but oftentimes we overlook the fact that if what's going on to their hands isn't favorable and is causing that irritation, that missing out on those opportunities is going to continue to increase. So foundationally, it'll be a look at that formulation aspect. Additionally, we're going to take looks at things that are unique and innovative to us as well as it relates to the behavior modification program, as well as our different innovative point-of-care solutions that we have. So what we prove with each and every one of our partners through on-site clinical analysis is that we have those products that people want and prefer to use. Anybody can make that statement, but until you come in and physically have hundreds, if not thousands of clinicians participate in that evaluation, you really don't know just how different it is of what you're bringing to the table. And what makes Symmetry so different is that it dries quickly, it keeps your hands hydrated to prevent them from drying out, and you're also not left with that sticky residue that makes it not just uncomfortable, but also difficult to don gloves. Because as we know, if we're following the WHO 5 moments for hand hygiene, I'm supposed to sanitize or wash my hands before donning gloves. But if I get in the routine of using a product that leaves that very sticky and tacky residue left on my hands, when I go to apply those gloves, it's very difficult. So oftentimes what you'll find out from the doctors and nurses is they just skip out on performing hand hygiene before donning gloves with the misconception of, well, I'm wearing gloves, I'm going to be safe, totally missing the fact that that microbe on their bare hand that pushed that glove onto the other hand is now on the exterior and coming in contact with our patient. So all these different characteristics and attributes ultimately lead to a much different end user experience as it relates to the product. What also makes Symmetry very appealing is that we are also able to save organizations not just on the product cost, but also on the costs that result from the increase in infections that are being spread when you look at longer hospital stays that become a result of that, for example. So what I've included is one of the first studies of its type that actually dollarized the cost of non-compliance. So this study was put on by Duke University Medical Center at an average size 200-bed hospital. And what they focused on was just the transmission of MRSA because of a failure to perform hand hygiene. And the results were quite astonishing, where they showed that this one hospital was incurring about $1.8 million annually just because care providers failed to clean their hands at the appropriate times. What the study also showed is that a minor 1% increase in compliance resulted in about a $40,000 save to that organization annually, which is essentially the elimination of one of those MRSA infections being transmitted. So the conclusion of the study was quite clear that hand hygiene non-compliance obviously ties into significant hospital cost. What's most noteworthy, in my opinion, is that the study also indicates that MRSA accounts for fewer than 8% of all HAIs. So even though that $1.8 million number is so staggering for a 200-bed facility, as they say, that's actually a significant underestimation of the true cost of noncompliance, given that there's 92% of other infections that aren't even being factored into this study, since they did focus on just MRSA. So on 2 slides previously, I had mentioned how we are able to consistently prove that preference for our products through that on-site clinical analysis. Anybody can make a statement like that. Where I'm from, you can probably tell my accent isn't local. So where I'm from in the United States is St. Louis, Missouri, and our state motto is the show me state. Essentially, put your money where your mouth is and prove to me that what you're saying is true. So as you can see here from the Symmetry Challenge evaluation that took place at Advocate Aurora Healthcare, where we focused on the 14 hospitals of theirs that were in Wisconsin, whereas you have another 11 that are in Chicago and Illinois, during the peak of winter, when temperatures are well below freezing for well over 6 months there. So naturally with that cold, people's skin health and integrity is compromised just from the environmental factors on their own. So to perform this analysis in really one of the most intense times on skin health really speaks even additional volumes to just how different our product formulation is. So the criteria that we had the clinicians evaluate off of come from APIC's implementation guide to hand hygiene programs, where they outline these 6 key characteristics that should be factored in and considered when looking at a new product evaluation. We didn't want the team members to simply use the product and say, yes, I like it, or no, I don't. We wanted them to actually think through and evaluate these different characteristics and attributes. But as you'll see, the end result from this shows that of almost 1,400 participants, 1,308 selected Symmetry as the gentler, better, more preferred product, whereas only 44 chose the Purell. So a 96% approval rating, if you will. Another example of this data collection comes from Presbyterian Health Services and from the first hospital of theirs that we had trialed there in New Mexico against the Ecolab product. And running through that same analysis and using the same criteria, again, you'll see that 90+% acceptance for the Symmetry products, with 104 choosing Symmetry versus only the 7 choosing the Ecolab. And it is worth noting, it's not as if I selected some of these evaluation results that had this staggering preference shown for Symmetry. The simple fact is, of the hundreds of these that we have done around the thousands of these, I should say, that we have done around the globe, we have never lost one based on preference. And that margin of victory isn't like 51 to 49, we just barely beat them out. Landing in that 90 percentile is very much the expectation, because that formulation and the way it makes your hands feel is just that much different. The last example I'll close out with from the Symmetry Challenge standpoint took place at BJC Healthcare's Alton Memorial facility, where again you'll see 139 participants selected Symmetry as the preferred product versus only 3 choosing the ICP Medical. So what this leads to is phase 2 of our evaluation process. So BJC as an organization looked at this and said, wow, we have a significant opportunity to increase compliance across our entire healthcare network. So let's do a deeper dive, and let's task Dr. Jeannie Zach, who is the Director of Infection Prevention as well as Occupational Health at the Missouri Baptist Medical Center, with running this full internal product evaluation for an extended period of time going in excess of 5 weeks. So we are very fortunate to have Dr. Zach spearhead this analysis for us and run this trial. So of course, what Dr. Zach wanted to first do was collect baseline data on staff's feedback for the current products. She had seen the results that came from Alton, but as any good study, has to have put in place, you have to collect the data along every phase of that process. So Dr. Zach surveyed her staff and asked them questions that were very similar to those that were shown on the Symmetry Challenge form. The one I would draw your attention to that does a wonderful job summarizing folks' overall thoughts is question number 7 that states, my skin does not feel dry, irritated, or chapped after using this product. As you can see, an alarming 55% strongly disagreed with that statement. So if 55% of your care providers are experiencing that irritation and discomfort, obviously the likelihood to be very non-compliant to avoid that discomfort is going to be quite high. Conversely, when we outfitted the 10 units listed at the top with the Symmetry product, and then Dr. Zach once again ran that survey and had the team members fill out the evaluation following that 5-week time period, you'll see that the responses significantly changed. Bringing our attention back to question number 7, which again, my skin does not feel irritated, dry, roughed, or chapped after using this product, you can now see that greater than 90% strongly agree with that statement. And if we think back to that Duke study, for example, a minor 1% increase in compliance reduced one of those MRSA infections within that 200-bed hospital. Well, clearly one can conclude that compliance is going to continue to go up much higher than a minor 1% when you have such a high percentage of your staff that actually likes and prefers this product versus what was previously in place. So ultimately, the system elected to move forward because of the positive impact that this would have on patient care and improving patient outcomes. But there was additionally the incentive to them that on just upfront product cost on only the sanitizer portion of the program, they were going to save over $200,000 annually. So you can see that they had highlighted this in a correspondence that went out to their 50,000 plus employees, highlighting to them that not only are we making this move for a better, more preferred product, but that we're also going to have that significant financial savings as well. Shortly after this, when the hand soap trial and conversion took place, it also netted them an additional $170,000 save. Now, a lot of times infection preventionists will ask me as they continue to sit there and use the Symmetry product, they're like, it's so much softer, it's so much more gentle. Am I compromising on anything? And of course, the answer to that is no. Prestigious healthcare systems like Emory and BJC, of course, wouldn't implement us if we didn't meet those requirements as it relates to efficacy data, kill claims, and the various levels of testing that we must run through. So as a U.S. manufacturer, we, of course, have to follow the FDA's tentative final monograph, go through extensive irritation and sensitivity testing via the repeat insult patch test and the Solansky method, and of course, meet those benchmarked efficacy standards that are required for healthcare. So foundationally, it all begins, in our opinion, with that product formulation and having the right products in place. But what's really neat as we look to make this program customized to your specific organization, your specific initiatives, and your specific goals is where we start to look at some of the unique things that we can do with program customization. So as you can see here from the Shriners Hospitals for Children, not only are we able to do things like the custom color combinations, custom logoing, and custom messages on the dispensers, which is a sheer value-added component to our partners, but when partnering with Symmetry, you also gain access to our internal graphics design and marketing division of our company, where we can work hand in hand to create different unique educational and awareness components that we can help implement to continue to push and promote that message of hand hygiene throughout the organization at all levels. To really take this to a next level is something very unique to Symmetry that we developed with Dr. Adam Alter. So Dr. Alter is a PhD in behavioral science and also a New York Times best-selling author with his book Drunk Tank Pink. And what this unique aspect of the program is our behavior modification program, where we utilize behavioral science to drive hand hygiene compliance. So essentially, there are different visual stimuli and cues that subconsciously cause all of us to react and respond in a certain way, even though we're not aware of it. So most of the time where you'll see this behavioral science applied comes from like a retail environment where all these huge companies like Coke, Pepsi, Snickers, etc. have behavioral scientists on their payroll working hand in hand with their marketing team to incorporate this psychology to ultimately lead to more sales. So in working with Dr. Alter, it was fantastic because he had no experience or understanding as it relates to healthcare and as it relates to the significance of hand hygiene. So as we began to educate him on this, to see his excitement as his brain started spinning and he was coming up with different ideas and different technologies that we could incorporate into the program to increase the likelihood that people are drawn to the dispenser was really invigorating for us as well. So a few examples of where this is seen outside of our industry. Anyone that has children, I'm sure at one point has had to drag them along with you to the grocery store, right? And it just so happens every time we're waiting patiently to check out and we've got all this point of purchase items right there on the sides of us, next time you're there, take a look and you're gonna notice something interesting. All the very bright colored packaging and all of the sugary snacks, the stuff that the kids love, is located where? Way down low, exactly. Not where me at 6'4" wants to get it, but boy, my son, right there where he can pick it. So Dr. Alter had shared that there's psychology behind the color of the packaging and what catches people's eyes, hence things like the bright colored dispensers. But he said when that's there, as soon as that child grabs that snack and starts begging for it, the likelihood of purchase goes up enormously. Because even if I tell my son no, what happens next a lot of times? The temper tantrum. He starts pouting. He starts getting loud, right? So now I have a decision to make. All these other nice people waiting so patiently to check out are looking at me because I'm the one with the loud, fussy kid. So do I hold firm and tell them, no, your mom's at home cooking dinner? Or do I I hold firm, but many throw it right on that conveyor belt and end up buying it. And Dr. Alter's like, you wouldn't believe how many millions of different candy bars and sugary snacks get purchased where the folks going into the store had zero intention of doing it. So you might be thinking, okay, so how in the world does this work in the hand hygiene space? Well, what we outlined with Dr. Alter are these 6 key tenets that people subconsciously do react and respond to. The main ones, and there's additional ones, but these are the most powerful, is benevolence, responsibility, accountability, variation, emotion, and direction. So for example, how this gets applied into the hand hygiene space. So you take Emory University healthcare system that's based in Atlanta, Georgia. If you guys have ever, as you look through different white papers, their contributions to research and hand with the CDC is, speaks volumes to their credibility and just how impactful they've been to healthcare as a whole. But when we converted that system, you had all this excitement. We went through this huge trial. You had 90+% of the care providers who selected and wanted Symmetry as the better product. Then they get these cool blue dispensers with their logos for their hand soap. They get these cool white and blue dispensers for the hand sanitizer. So for the next 6 months, 7 months, whatever it may be, it's new, it's fresh, it's different. But what happens when 8 months, 9 months, a year and a half down the road, you're working that same unit each and every day, right? So eventually all the fixtures on the walls and all those different things just sort of blend in and they don't stand out like they once did. And that's where things like these behavioral driver placards come into play, where now I can incorporate those 6 key tenets into the different placard design. So for example, if you see the premature child with the little tiny feet in that person's hands, that plays to the tenet of benevolence. It pulls at your heartstrings. If you're walking by and you notice that, there's a whole heck of a lot better chance that you're gonna stop, pause, and reach over and actually use the sanitizer, for example. Other things with like the red placard with the overt direction to it. So the point is not to put these on each and every dispenser, but to use them strategically, to change them up, to have them spaced out, because I'm creating something new, something different, and something that catches my eye. Where this has a huge impact as well is on patients, family members who are visiting. Because a lot of the times they think, oh, is that product hospital grade? That's for the doctors and nurses. I can't use it. And as we know, oftentimes it's them who bring in, different infections that ultimately the patients catch. So a multitude of different ways that this catches people's attention and again draws them back to the dispenser. Sort of looking at the 2.0 version of the placards, which are two-sided and can be flipped, is what we refer to as our motive, which is a digital behavioral driver placard that also can incorporate sound and gets activated as people walk by it. So now I can have rolling through all sorts of different, behavioral science attributes that catch their attention and again increase the likelihood that they use it. A lot of different things you can do with this as well with, upcoming hospital events or things that you're focusing on, a promotional thing for a charity that month. All this can get loaded onto there and used as well. So all kinds of fantastic uses. And I should have said this on the front end. I'm obviously speaking at a very fast pace to try to cover a lot of the information given the time slot that we have for this. But please do know we are upstairs in the vendor hall as well, to where we can, of course, get back together and chat on these different sections, at a longer length if need be. Something else that we've incorporated from a behavioral science standpoint is what we refer to as our VLC, our visual lighting cue. So it's this simple LED battery pack that clicks right into the bottom of the dispenser and then flashes and pulsates that light. So you're creating variation from the movement and flashing of the light. You also, of course, are playing into the use of the colors to catch people's attention. So it's no surprise when you're driving down the highway and all of a sudden you see flashing lights in your rearview mirror from the police officer. It's an immediate thing that causes you to perk up and react. And it's the same as people come in and that light starts flashing, it catches their attention. And as you can see from the American Journal of Infection Prevention, right along the time that we had released this tool, they had actually conducted a study where they went and put different flashing lights in and around the dispensers and saw that 49% increase in compliance just from having that trigger to catch people's attention and draw them towards it. Sort of the evolution of the VLC is what we refer to as our Behavioural Beacon. So this is a really neat tool where upon dispense on the dispenser, once that product is shot onto the user's hands, you will get an emoji that projects and shoots down onto the floor. So it's an immediate reward, right? It's immediately like job well done kind of gamification thing. But it also works really well beyond positive reinforcement and patient engagement because, of course, patients are going to ask, hey, what's that smiley face? You get to talk to them about hand hygiene and why it's important. But also that just-in-time coaching piece is very significant because so many places do encourage just-in-time coaching, but let's be honest, if a housekeeping team member sees a doctor not sanitized going into the room, how often are they comfortable to go up to them and remind them that they should be performing hand hygiene? Oftentimes that's not the case. So what's great with this is now as that doctor comes out of the room and is, notating what care had been provided and somebody else down the hall hits that dispenser, he sees that heart, that thumbs up, that smiley face emoji, and it's that little reminder for him as well of, oh shoot, I forgot to sanitize when I came out of that room. So all these different subtle ways that this can get incorporated. One of our hospital systems back in the States, they actually place a dispenser at the head wall in front of every patient bed, and they have a big sign above it that says, if you don't see the smiley face when your care provider comes in, ask them to sanitize their hand. So it just gets them involved with their own level of care and their own level of safety also. So you might be thinking, okay, these are really cool approaches. This is a really neat science, but is there any way to actually collect the data to see just how impactful it is? And the answer to that is, of course, yes. So with a healthcare group in Chicago called RML, they had seen such a spike in their compliance whenever the Symmetry program was implemented. And then they saw a further spike in compliance once the behavior modification components were implemented. So they started working with a statistician from Northwestern University and contacted us and said, look, we want to run this study to see just how impactful and powerful the behavioral science tools are. We obviously can't do observation on every dispenser 24/7, 365. Is there anything you'd be willing to do to work with and help with to develop so that we can collect that data? So what we built out was our Symmetry radar system. So this isn't something that we go out and market and sell. It's just something that we use for data collection with our partners for these type of studies, where it's a Bluetooth-enabled actuation counter in each each dispenser so that 24/7, 365, when that dispenser gets hit, that usage is stored, shot to the analytics dashboard up in the cloud so that we can see just what's been occurring at any time throughout that trial. So I'll direct your attention to the first 3-week baseline period where there were no behavioral interventions. It was simply the dispensers on the wall. And what you'll see is the average usage per week was 4,479 actuations. Conversely, the following week when we introduced our accountability mirror, which is a plastic mirror placard that slides behind the dispenser, playing to the Big Brother or the Hawthorne effect of if you have the sense of you're being watched, you're going to do the right thing. So you'll notice that usage spiked more than 3 times over the baseline to 15,000 plus actuations. Following the week using the accountability mirror, we then changed up to a different yield sign placard, also installed the VLC to put that flashing light there, and you'll again see that usage spiked just under 3 times what the baseline period was of that 4,479, all the way up to 13,320. So really showing just how impactful these neat tools can be. They're much more than neat tools. Another area of focus, of significant focus within the U.S. especially, and I know from speaking with our team here that this is certainly holds true in the U.K., is for our behavioral health units, for our mental health units and psych. The need to build out and have solutions in there that have additional safety measures to them in the event that one of our patients tries to inflict self-harm, whether that be through ligature or whether that be from the breaking of a device to weaponize against a fellow patient or themselves. So something that we have to address that space is what's referred to as our resilient dispenser. So even though it has the visual characteristics of a traditional plastic dispenser, it is actually completely made of die-cast aluminum. So it's a metal dispenser enclosure so that it can't be broken and weaponized. And then as you'll also notice, everything is at an angle and at a slope with the round corners to ensure that you have that ligature resistance in the event that somebody does try to tie something around it to, do self-harm to themselves. So another very important and very impactful aspect within the line that's available. From a product standpoint, of course, I have a full array to meet the specific needs, whether it's gels, foams, fragrance-free, you name it. A thing worth noting is that all of the product formulation has always been made in the U.S. I know a lot of folks have seen where other manufacturers were sourcing products from, areas like, China and other locations like that, and all this supply chain crisis that's been hitting everybody has really hampered a lot of folks in their manufacturing capability. Fortunately for us, all of our dispenser components, all of our pumps, bottles, product, all of that is made right in the U.S. so that we were able to maintain a continuous and consistent supply chain even during the pandemic when partners of ours who historically would say their system would buy 2 million, they're buying 4 million now during that course of that time, but there was no disruptions to when they were getting product, there was no allocation. And that's also why for our UK partners, we were able to also consistently provide the products that they needed without back order allocation. The next piece to take a look at would be point of care. So in the U.S., the accrediting organization is, of course, the Joint Commission. And for years, they've had National Patient Safety Goal 7 that puts strong emphasis on the fact that we have to provide solutions during the direct care and treatment of our patients, since that's where the highest majority of infection transmission occurs. Well, back in 2018, they said, okay, enough's enough. We've been telling you for well over a decade that we need to have some sort of solutions for this. If during your inspection we're in there and we notice that you don't have these options available, you're going to get cited and you're going to have an RFI issued, which is a requirement for improvement. So when you look at WHO 5 moments, it's very clear that if you're only relying on wall-mounted dispensers, it's impossible to achieve 3 of those 5 moments that are outlined. So that's where we've worked to develop some of these different point-of-care tools so that we can get product easily available and accessible within the workflow, within the care and treatment of the patients themselves. So going from the far end, moving closest to me, we have our 50 mil patient tray table or WOW clip. So that bedside table there for the patient, if they're bedridden, if they are unable to get up and get to the restroom themselves, before I eat, after I use the bedpan, now I have hand hygiene clipped right onto my bedside table, readily accessible to me. If you're a care provider and let's say you're doing an aseptic task like inserting an IV, as soon as that IV is inserted, my gloves come off. They usually go in the receptacle right near the patient bed. How often does our team walk all the way back near the door to sanitize before coming back and resuming care as they're supposed to? Well, with it sitting right there on the tray table, now I can reach right over and use it. So it's direct forward-facing engagement with the patient, letting them see that I'm performing hand hygiene while also giving them a solution. So this works on a myriad of other things as well, like the computers on wheels, for example, that get wheeled around. You can have those clipped and available on there. The next one is a 550 ml suction cup, and I know this is such a hands-on visual type presentation, so not having it here to be able to walk around and show is kind of limiting, but again, we're upstairs to show these things. But now on phlebotomy carts, dietary carts, I can have that 550 ml suction cup bottle suction down securely so that it's not falling off, not getting knocked on the floor, so that I can get it where I need to have it stationary yet mobile. So the dietary team is a huge fan of these because so often they're our biggest contributors to a lack of compliance because I take that tray out to bring it into the patient, my hands are full, there's no way I can sanitize, and sure enough, as I set it down for the patient, they asked me to hand them, the TV remote or the phone that had fallen down, so then I walk out, grab the next tray, and in those germs go to the next patient. Whereas with something like that suction down to the top of their cart, now you've created their sanitizer for their use, and you have the policy of every time you return to your cart, you sanitize before taking that next tray. The next one you'll see is a simple lanyard, just something to have readily available on your person at all times. The next one is the 50 ml suction cup. So for the clip, let's say you have a surface that's really, really thick or really, really thin and you can't securely clip that on, you have the suction cup that can then suction right down to get that product where you need it. And the last one we'll look at is that anesthesia cart bracket. So our anesthesia techs oftentimes are challenged with maintaining compliance because of the landscape within the surgical suite. We've got the patient on the table, we've got the doctor and the surgeon, and the support staff around him, tubing's running all over the ground. How do I maneuver that to get to the wall where that sanitizer is? Well, having something like that anesthesia cart bracket that can hang right on the side or hang upon any drawer so that it's always just an arm's reach away is a huge benefit. I would also draw your attention to that center picture as well. So many times in our pre or post-op areas, they're going to look very similar to this, where we have these bays separated with curtains. Well, unfortunately, with the wound vac, the sharps box, and everything else that's mounted on that head wall, there's simply no real estate available to be able to mount and have a dispenser available for a patient to use. So if I close that curtain off, I don't have access to hand hygiene because mounted on the wall way down at that end of the room is a dispenser and way down at this end, but now when I'm closed off and providing care, I don't have a solution. And that's where, and I know it's hard to see on the screen, but having that 50 ml clip right on that patient tray table and then being able to have the stationary 550 ml pump bottle in the suction cup so that now as I'm in that room providing care in that curtained off room, I've always got it readily accessible to me. Then just a couple more examples. You can see the workplace on wheels or computer on wheels and just some of these different in-use applications. It's really a lot of fun to get with the partners and go out and round with you because when you have a box of these point-of-care tools, it's amazing because, of course, nursing is going to ask, what's that? What are you doing with these? And they're the best people to tap into and say, we're trying to find these solutions to get sanitizer in your workflow. Tell me where your trouble spots are. And then that's where you're able to go and have these different tools, to solve that need based on what info they provide. And then last piece as I close out here, another tool that we provide as a value-added aspect to our partners is our hand hygiene observation app. So the whole goal of this is to have a more consistent and a more robust data collection system versus using traditional pen and paper, where A, it's really easy to see if somebody's observing you when you still want to kind of keep it secret if you have other team members who are being secret shoppers as far as observation goes beyond the infection prevention team. But the other thing is you, of course, then have to come back and input that data to be able to use a way to break it down and analyze it. Whereas with this, any smartphone, any tablet can have it loaded onto it so that you can quickly and easily perform those observations and look at the specific WHO-5 moment at play, so that when you get and look at the analytics dashboard, you can break it down in a multitude of ways to know where to focus your attention. You know, if the nurses on this unit are doing fantastic, but the doctors are really struggling based on what the data shows, well, then now we know we can go have a pointed coaching and conversation with them because we actually know where the shortcomings are. So just another unique tool to use there as well. And at a rapid pace, that brings us to the end of what we had prepared to share here today.